From the JAMA Network, this is the JAMA Pediatrics Editor's Summary, a discussion of the most important articles published in the latest issue of JAMA Pediatrics.
Hello again, podcast listeners. This is Dimitri Christakis, Editor-in-Chief of JAMA Pediatrics, and with me, as always, is Dr. Alison Galbraith, currently at Boston Medical Center as the Division Head for Health Services. Great to have you here. We have two new papers to discuss. As always, you can go first, Dr. Galbraith. Go ahead. Let's hear what you've got.
Sounds good. So the paper I have today is called Prenatal and Infant Exposure to Acid-Suppressive Medications and the Risk of Allergic Diseases in Children. So it's a cohort study from No et al. From a variety of institutions around the world, primarily in South Korea. So they want to look at allergic disease because, the prevalence has been increasing, and also a lot of both pregnant people and their infants take acid-suppressive medications like H2 receptor blockers or protein pump inhibitors. Like in pregnancy, there's a lot of GERD and stuff like that. So, and there has been some prior data that suggests that there's an association between these types of acid-suppressive medications in prenatal and early life with allergic diseases in children. And the biological plausibility is that...
I was just going to ask what the
I had to look this up. It makes sense. So these acid-suppressive medications interfere with digestion of food antigens, and so that can sensitize the immune system. And then the other stream of thought is that these medications can alter the gut microbiome, which I guess is a predictor of allergic disease. But some of the prior studies that have looked at this relationship don't account for confounding by indication, right? So you could take acid-suppressive medication for GERD, and GERD is associated with asthma. And so maybe that's why there's this association. And then also there's some within family shared factors, inheritability, that haven't been previously accounted for. So this study was very elegant in trying to get around those issues. So they used data from South Korea's National Health Insurance Service mother-child linked database. So it's the entire Korean population. They looked at infants who were born in April of 2008 to December of 2019. And they looked at the full cohort of infants. And then they also constructed a sibling matched cohort. So there were where they found siblings who had discordant acid-suppressive medication exposure.
Okay.
And then they identified prenatal and infant exposure to H2 receptor antagonists and proton pump inhibitors if they had any prescriptions either during the pregnancy or in the first 6 months of life. And then their primary outcome was any allergic disease, and then also by individual conditions. So that was asthma, allergic rhinitis, atopic dermatitis, and food allergy, after following the kid for at least a year and up to 13 years. And so what they did that was very elegant is they did propensity matching they had a lot of potential confounders that they were able to control for, both sort of sociodemographic, socioeconomic, maternal medications, maternal allergic disease, healthcare utilization, infant indications for acid-suppressive medications and things like that. And then, so they did propensity matching. And then they also had a sibling-matched cohort as well. They had over 4 million parent-child pairs, which was very powerful.
Wow.
Yeah, these national databases are really nice resources if you can get them. Anyway, so they first looked at prenatally exposed infants. And in their propensity score match analyses, they did find a relationship between prenatal exposure to acid-suppressive medications, both for allergic disease overall and also for the separate conditions. However, the hazard ratios were pretty small. For overall allergic diseases, it was 1.02, and the confidence intervals were 1.01 to 1.03. I mean, you have 4 million people, so
right,
you can have these really tight confidence intervals. And then when they did that sibling matched for the prenatal exposure, there were similar effects, but it was not significant. And then when they looked at infant exposure to acid-suppressive medications in their propensity matched analyses, they did find similar significant relationships between allergic diseases and also specific conditions, a little bit higher effect size for asthma. But then when they did sibling matched, they did not find any significant associations except for asthma, where the hazard ratio was 1.13, with a confidence interval 1.09 to 1.17. And they looked separately for H2 blockers and proton pump inhibitors and some other sensitivity analyses, which also supported these findings. So their conclusion is interesting. So their conclusion is that there's no meaningful association between prenatal exposure to acid-suppressive medications and allergic disease. I think because the sibling matched analyses didn't find a significant relationship, and also the propensity matched analyses had really small effect sizes. They did say that there does appear to be association between infant exposure and increased risk of asthma. And so the implication of that is just, think carefully when you give an infant acid suppressive medications. And then if you need to, then you should be monitoring closely for clinical sequelae, I guess, meaning symptoms of asthma.
So, we publish a lot of studies our readers will know, and, we discussed at manuscript meeting that look at exposures and negative outcomes because we have a sort of propensity to do that. And, this was a study that actually provides some level of reassurance. Obviously, to provide a high level of reassurance, you'd like to have a narrow confidence interval, which they had by luxury of having such a large sample size. And so I guess the comfortable take-home message for parents or for prospective parents is that you don't need to worry about it. Would you agree then, Allie? Or?
Yeah, no, I think that's what they're saying. I mean, I guess the other thing that's useful is, you can say to a pregnant person, okay, if you have bad reflux, you don't have to worry too much about taking these medications. So that's sort of a reassurance there. And I think that even if there is this relationship, it's really not very large. And maybe for asthma, there's a relationship, but the other conditions, not really. So I think that's, it's reassuring. It's kind of a reassuring negative study.
It's a reassuring negative study. Of course, I think the general caveat that we should be mindful of anything we take when they're pregnant is probably still remains to be good advice. The next paper we have is outdoor play as a mitigating factor in the association between screen time for young children and neurodevelopmental outcomes. So to provide some context for this paper, there have been a number of studies that have been done, including some by me, looking at early screen exposure and subsequent developmental outcomes. I wouldn't say the research is consistent on it, but several studies have found negative associations between early screen exposure and subsequent neurodevelopmental outcomes, including most recently, by the way, autism, not work that we've done, but we published showing an association between early screen exposure and autism, for example. And, I like to think about the effects of screen use on child's development as having sort of two pathways. What I call the direct pathway, which is how does what children watch, the content they're exposed to, affect their development? And then the indirect pathway, which is fundamentally mediated through displacement. There are only so many hours in a day. And when a child is watching a screen of some kind, they're doing that activity in lieu of something else, whether that's engaging in physical play, social interactions with other humans, being read to by an adult, etc. And one such activity is outdoor play. So this study tried to see whether or not the effects that have been observed in other studies between early screen exposure and subsequent neurodevelopmental outcomes was mediated by outdoor time, which is to say that when you adjusted for outdoor time, did that effect get reduced? Did it get mitigated, or did it even go away? I have to say, there are times where I feel like this is over controlling anyway. I mean, even though I conceptually identify these two different pathways, at the end of the day, the net result is the same, that early screen exposure can have deleterious outcomes. And so, whether it's direct or indirect, too much screen exposure is bad. I suppose the reason this is relevant research, and I think part of the reason we published it, is that it could be that the indirect pathway is the more salient one when the content of what children watch is adjusted for, which is to say that there may be some content itself that's harmless, but it displaces other activities. That's a very long preamble, but I wanted to set the context for why this study was even important. And they used, again, a prospective longitudinal design, and they asked the parents of children when they were 2 how much screen time their child had. And they dichotomized that as over an hour or less than an hour. And then when the child was 4, they did a comprehensive kind of assessment of their neurodevelopmental outcomes. And then they did this mediation analysis, which is to say they looked first at the association between screen exposure and developmental outcomes, and then they added outdoor time as reported by parents and checked to see how it interacted in a variety of ways to see if it mediated the association. It's a complicated technique, and if anyone's interested, they can look at it in the paper itself. But the long and short of it was to test robustly whether or not the effect that's observed is mediated by outdoor time. And to summarize their findings, what they found was that higher screen time by parental report at age 2 was directly associated with poor communication at age 4, as well as with daily living skills. And then outdoor play, as reported by parents, did mitigate the association between higher screen time and suboptimal neurodevelopment, but it really only did it with respect to daily living skills and not the other developmental outcomes. So, that's kind of the long and short of it. I think the reason the paper was, at least for me, interesting was because it did try to elucidate the pathway by which screens may affect child development. There's some limitations to the paper that I think are worth noting. One is that screen exposure was assessed at 2 years by parental report. Most children are watching quite a bit before then, and clearly there are other early developmental activities that are either being displaced or screens are having a direct effect earlier than that. And we tend to think of parental report of screen time nowadays as not being very precise. The problem is none of us, myself included, have found ways of really measuring it very accurately. There are some technologies now that you can put on screens, but again, the problem is that most children this young aren't, thankfully, watching on their own screen. They're watching on their parents' iPhone or on their parents' computer or on a television with a DVD player or whatever, or YouTube. And it's difficult to collect all the screens that are specific for young children.
There definitely wasn't social desirability bias because, their threshold for high screen time was the AAP recommended 1 hour per day, and the mean was 2.6 hours per day. So most of them are over. Yeah.
No, you're over. That's right. But it wasn't very precisely measured, is my guess.
Right. So one thing I was curious, because this is your area, if this is the right way to interpret their findings. So they didn't find a mediating effect of outdoor play for the link with screen time and communication skills, but they did for daily living skills. And so do you think that's because this is sort of the displacement issue, right? That if you have outdoor time, that's great, but that's probably not when you're communicating, reading, talking with your parent, right? So maybe for daily living skills, I'm not sure how the Vineland measures these things, to be honest, but it seems like outdoor time is not going to offset the communication gains that might get displaced by giving your kid a screen instead of like reading to them, talking to them.
Agreed. And of course,
Is that fair?
No, it is fair. And, we talk a lot about the need for better granularity when it comes to assessing screen usage with respect to the precise time and content. And, outdoor play is its own thing, right? Because outdoor play can be any number of different things. We tend to normally think of it as promoting physical development because we tend to think that, toddlers are outside running around. But they're also, depending on the situation, engaged in negotiation and compromise and developing social emotional capacity because kids' feelings get hurt or they get physically hurt and they have an opportunity to render care and assistance. But you're right. Clearly, it's a hodgepodge of activities. It's crudely measured as one sort of construct, whereas something like, reading with the parent, by definition, is going to be much more interactive and much more focused on social, emotional, and cognitive development. Now, there are many people that feel that outdoor time has its own value and should just be a measure in and of itself. And I think there's a lot of value to that. I agree. In fact, one clear value of outdoor play is it reduces myopia. And we've published papers showing that it's another example. When I was a kid, my grandmother used to say to me that watching television ruins your eyes. And in fact, I am nearsighted, but I guess she could say she was right, but it wasn't the TV. It was the confounder. It's that not being outside, again, the displacement effect that's driving that association.
The other thing I thought that was interesting about the paper was kind of in the context of COVID, right? A lot of kids were indoors, they had screens and they maybe didn't go outdoors as much. And so it also makes you think like, okay, if for whatever reason you feel like your kid needs to have some screen time, can you help offset that by also making sure that they get to run around outside?
Yeah, no, that's right. That's a very, very good point. Anyway, so the take-home message, outdoor play, good, fine, screens, bad, and it looks like antacids, at least in moderation, are fine during pregnancy and early childhood. Is that a good summation of this podcast?
Yeah, that's the general gist of it.
Thank you all very much again once for listening. This episode was produced by Daniel Morrow at the JAMA Network The audio team also includes Mary Lynn Furkaluk, Audrey Foreman, Lisa Hardin, Hannah Park, Shelley Steffens, and Dr. Linda Brubaker, Senior Editor, Multimedia. Thanks again for listening. You can find this podcast at jamanetworkaudio.com and wherever you get your podcast. Thanks again to Ali for helping me. We'll see you next month. Bye-bye, everyone.